Welcome to the Plain English Public Health Weekly Report. I'm Richard Greenland, and today is February 26th, 2021. As always, we start with our COVID-19 statistics. Worldwide, we have nearly 115 million cases and over 2.5 million deaths. In the United States, we have over 29 million cases and nearly 525,000 deaths. This week's COVID-19 news has been a mixed bag, with some good and some bad. So let's start with the bad news just to get it out of the way. First, cases are no longer dropping. They've kind of plateaued or flattened out. We're not sure exactly why that's the case, and it's only been for 1 week that's been happening, just this past week, so it may be a temporary thing and no big deal. We'd much rather, of course, like to see the cases continue to decrease, but if it is temporary, it's not a big deal. The timing is about right for the fallout from the Super Bowl gatherings to be taking effect, and so that is the prevailing theory right now as to why it's kind of leveled out. At least we're not seeing a spike, and so that's good, but that leveling out could possibly be from the Super Bowl, but we honestly don't know for sure if that's the case. Hopefully the cases start dropping again soon. Other bad news is that we've got a new variant in New York with similarities to both the South Africa and the Brazil variants. That means that it seems to spread faster, and it seems to be resistant to vaccines, the current vaccines that we have. In addition to the one found in New York, there's another one that's been found in 13 different countries, including the United States, that also has similarities to the UK variant and the others too. The California variant that we've talked about a bit lately has been found to be much more dangerous than previously thought. In fact, they estimate right now that about half of the current COVID-19 cases in California are caused by that one variant. So it is definitely spreading more than was previously thought, and it also seems to possibly cause more severe symptoms also. All the different variants are the main wild cards right now in COVID-19. Without the variants, we'd probably have herd immunity by late April, maybe, just because of where the vaccine schedule is and everything else with getting stuff out to everyone, at least here in the United States. Because of the variants, however, and the fact that it looks like to some degree you can get the different variants, even if you've already had COVID-19, with one of the more original strains, or even after the vaccine to some degree. Again, it's still really early in the vaccines and really early in the variants to be completely certain of this, but some of the early studies do kind of show this, that you can get a different variant after getting the vaccine. Again, it's reduced effectiveness. The vaccines have reduced effectiveness against the variants, not zero effectiveness. So it's still most likely that you will not get a variant after you get the vaccine, but there's a chance. So because of all that, the more likely scenario is that we will probably reach herd immunity between maybe end of summer or beginning of fall of this year. At least that's what most public health experts believe. Again, it's still the variants are still wild cards. If the variants become worse, or if people refuse to get the vaccine, or if people just get sick and tired of following the CDC guidelines and just stop doing all that, it could take even longer. So there's all that. Right now, we're hoping to get it all under control by fall, because if we go into another winter, chances are we're going to see a resurgence because everybody's going to get back into their houses and everything, just like we did this past winter. We're going to have all the gatherings, and so we're probably going to see a resurgence then. So we're hoping to have everything under control by late summer, early fall, just to give us enough time to build up that herd immunity and get it so that it becomes not an issue. It's not like it's going to go away. COVID-19 will probably be with us forever, but the risk of COVID-19 will be pretty much nothing after that point. So we'll see. So let's move on to some good news about the COVID-19 this week. First off, the Johnson & Johnson vaccine has been reviewed by the FDA in the United States and will most likely be approved for use later today, probably. In fact, by the time this video comes out, it may have already been approved. If it's not today, it'll most likely be tomorrow or possibly as late as sometime next week. But it very much looks like it's going to be approved really quickly here. Remember, with the Johnson & Johnson vaccine, it's a single dose, no need to wait for a second dose, and it's got 66% effectiveness at stopping the COVID-19 completely, but it does have 85% effectiveness in avoiding any severe symptoms, and it actually has 100% effectiveness against hospitalizations and deaths. So even though on paper it may not seem that great, at 66% effectiveness, that's the number that's usually thrown around. In reality, if we can avoid any hospitalizations and deaths from COVID-19, that's a win, a big win. So 100% effectiveness in all the studies, yeah, that's good. So having an extra vaccine available will definitely help with building that herd immunity more quickly. Canada has approved the AstraZeneca vaccine, and so that'll help them. No word yet on when the FDA in the United States will approve it. After more studies of the Pfizer vaccine, the FDA has approved keeping it at regular freezer temperatures instead of the sub-zero, super cold freezer temperatures that they used to have to do. They used to keep it like that, really close to the time of actually giving it to patients. Now, for up to 2 weeks at least, they can keep it in regular freezer conditions. And so that means most clinics and pharmacies and doctors' offices, hospitals, most places will be able to keep a good supply on hand. There will be less waste, and we'll be able to give out those vaccines and distribute them much more easily. That's amazing news right there. New studies have also shown that the Pfizer vaccine is actually quite effective after just the first dose. Some initial studies kind of showed that it was a little bit less effective, maybe in the 30 to 40% range for the first dose. But now later studies are showing that it's actually closer to about 75% for just the first dose. Still definitely recommend getting the 2 doses because that's the way it's been designed. And there just haven't been enough studies on a single dose to be able to say that, yes, you're fine with just a single dose. So please, if you're getting the Pfizer vaccine, make sure you get the 2 doses still. Also, for both Pfizer and Moderna vaccines, new studies show that the effectiveness of the vaccine becomes greater over time. This isn't surprising, just based on how immunity responses work, but it's good to have the scientific evidence there to back it up. After 15 days after the initial dose, it's about 75% effective, like we were saying. For Pfizer, it's similar with Moderna, based on these studies. After 36 days, that effectiveness rises to 83%. Once you get the second dose, which is typically within those 36 days, then you've got around 90% effectiveness for stopping the COVID-19 cold. You won't ever get it, even. So that's really good. Probably the best COVID-19 news we have this week is that we have some definite proof that the vaccine is working. Nursing homes across the country used to have the highest rates of death from COVID-19. Since patients in nursing homes were prioritized for receiving the vaccines, however, deaths in nursing homes have dropped dramatically. Everything else has basically stayed the same, all the different variables, and so it pretty much has to be the vaccine that's causing it. And so this is really good news. We've got, the vaccine is stopping the deaths, stopping the hospitalizations, and so it's great. It's really working. And this is even in the older populations that are more sensitive and more likely to get those severe symptoms. So great news. As we've said in pretty much every report that we've done, please don't use this good news about the vaccines to justify stopping following the CDC guidelines. We've still got more vaccines to give out before we reach herd immunity. We've still got those variants that are wild cards. We need to continue following those CDC guidelines. So please keep wearing the mask, keep avoiding crowds, keep practicing social distancing, and keep washing your hands. We can definitely beat this. We're turning the corner. We're doing well, but we need to keep at it. So thank you for watching the Plain English Public Health Weekly Report for February 26th, 2021. As always, we've got links below the video for stuff we couldn't get to today and for more information about the stuff we did talk about today. I'm Richard Greenland, and you have a healthy weekend.